thank you so much for being here with us today. So as you know, at Bling, we want to empower individuals with their periods, and we also want to break the stigmas around menstruation. So in today's interview, I would like to ask you a couple of questions regarding misconceptions and myths around this topic.
Well, thank you for inviting me to speak. I'm really passionate about quality of life, gynecology. Initially, when I was in medical school, I was very interested in obstetrics. I did an international rotation and was drawn to global health and safer obstetric practices, so maternal mortality specifically. I went into OBGYN residency and actually really enjoyed working more with quality of life medicine. So pelvic pain, sexual pain, heavy menstrual bleeding. And I went on to do a fellowship in minimally invasive gynecologic surgery. And then I did another year in pelvic pain management. So now my practice is very much benign GYN, abnormal uterine bleeding, endometriosis, uterine fibroids, and improving quality of life in women.
I want to talk a little bit about understanding more around the menstrual health. So in your experience, what are some of the common conditions or challenges that menstruating individuals face?
So menstruation, if you just take a step back, this is a significant part of many people's reproductive lifespan, right? So a quarter of your reproductive life, you may be preparing to menstruate, menstruating, or recovering from that process. And so I think sometimes we forget about how big of a scope it is.
Yeah.
And it starts in early adolescence and it may not end until you're early to mid 50s. So a huge part of your life.
Yeah.
Some of the problems I think that come out are just not having a lot of information about managing heavy menstrual bleeding or managing and recognizing pain associated with your periods. And I think right now we're in a really ripe time for information, but then you have to navigate some of the misinformation around that. But I think the biggest deficit we still have is removing the stigma, like making it not a taboo to talk about menstruation. And really looking at the tools you have to either reduce your period, manage your bleeding, stop your bleeding, and knowing kind of the pluses and minuses of all of those.
How often do you think these things like the pain, the diagnosis go like overlooked because of misinformation?
Yeah. So still more than we would like. I think if your periods because of heavy bleeding or pain are really impacting your quality of life. So where you are, it's more than just maybe taking a couple of ibuprofen, but where you are missing school, missing work, missing or not engaging in activities, worried that you might have an accident, not knowing when you're going to start menstruating. Maybe, to speak to your really novel device, like not knowing when you where you would clean your menstrual cup if you had it. Like I think that those fears and I think some of those kind of like more peripheral questions we're still navigating. But I would empower women when they do have these questions or if they're not meeting their personal lifestyle goals, that they should then reflect and think about it a little bit more and hopefully reach out to people who might have more answers, whether it's a doctor or a trusted friend, a parent, to get more information.
Talking around like the knowledge gaps, why do you think there is such like a widespread lack of education about menstruation and reproductive health?
Yeah, well, where do we start with that? You could start with just, if you even like think about the foundation of reproductive health, we are significantly further behind than I think other areas of medicine.
Exactly.
And we've been behind. And I think you can see that from, even looking at the National Institute of Health and how we've been funded from a research, like historically, and I don't want to bore everyone, but we've been behind, right? The Office of Women's Health Research didn't even get started until the 80s. We didn't start requiring women to be part of research until the early 90s.
Wow.
We didn't start requiring animals to, in animal studies to be equal men and women, or male and female, so that way we had information about the menstrual cycle and how it affects medicines. And so I think that we've been behind, and it's hard to reconcile because we're behind from a research foundation, but we seem to be in this space of a lot of information. So it's a disconnect. But I think the question is, what's a good information? What's the information that might really positively impact your daily life? And I think it is hard. I mean, when you have so much information, to then find out what's information that is true, that like I identify with, that I feel comfortable with, that's safe. Because I think you've seen a lot of information come to you, like if you're searching for something like pads or menstrual cups or tampons, and you may not be able to differentiate, even a really educated person, like, is this real or is this not so real, right?
Exactly.
And I think we see that with like tampon use and chemicals in tampons, or pad use and risk of that, or menstrual cup use and risk associated with that. So I think it doesn't make sense, right? You have all this information, and then what information is something that you can actually like dig into and use.
Exactly.
Yeah.
And what do you think it could be done to like help reduce that?
I mean, I think that, I'm a huge fan of making sure that information's accessible, because I think, I think that using social media platforms are really important, but I do think that some vetting, right? It's people who are familiar with the disease process, and can hopefully help make sure that the right information gets to women. So I think that just making sure that, maybe you fact check or double check your sources. Go, if you identify a place that you are like, I really believe the information that's on this website, and there are physicians and nurses and people who are constantly checking. I think that that's helpful. And then I think it's also a commitment of, teams who are participating in social media to make sure that the information we provide women is correct.
Exactly.
And so I think that that's why one of the things that's really great about, Bleen, and then you not only the, trying to make things easier for women with menstrual health and cleaning, like menstrual cups, but it's also your engagement and commitment to making sure that valid information is available.
Exactly, yes.
And you don't always find that everywhere.
Yes, that's true. And talking about more about the myths and misconceptions around menstruation, what are the most persistent myths and misconceptions you encounter about menstruation, and how do you typically address this at work?
I mean, I think that there's quite a few. I mean, everything from some women choose to not menstruate at all, right?
Yes.
And that is a very healthy and reasonable option. So there is, I think one of the most common myths I hear is, well, I don't want to not have a period because it's not healthy or it's not safe. And I would say that certainly if you're not having a menstrual cycle without a medication to suppress it, that you're right, that is not safe. But if you're on a medicine and you're choosing to be on a birth control pill to either lighten or stop your period, that is a very safe thing to do that will not affect your reproductive outcomes later.
Okay.
So that's one.
That's one.
I think when it comes to menstruation, similarly, women think that their periods are supposed to hurt, or they're supposed to have a lot of bleeding. And that's partly, some of that is things that you may learn from your own family members. So you're in a family where everyone has heavy, painful periods. And so there's this expectation that may be normal. And so I think that sometimes really trying to encourage patients to, push against that a little bit, and like, maybe you shouldn't be bleeding that much, or maybe it shouldn't be that painful. And many women who maybe not in your immediate circle don't have significantly heavy or painful periods. I think some women many women choose to have a menstrual cycle, and so I think that also making sure that there are some constructs around that. So if you are having a menstrual cycle, you should still be able to do activities, right?
Exactly.
Whether it is, go to social events with your friends, engage in school or work. And so I think if you find yourself like normalizing, like I can't actually do anything for that full week a month, that is not normal, right?
Exactly.
So I think that, and then I think the other thing too is we find that patients who, may not be doing a lot of activities because they're worried about things when they go out. So they're worried about, okay, I have to make sure I bring my protection. I have to make sure that I can, clean my menstrual cup. I have to make sure that I can, what if I have an accident? I need to, oh no, I have to bring an extra pair of clothes. Like that kind of layered planning thinking can be really exhausting.
Yes,
if you have to do it 25% of your life, right?
Your life.
Like that's a lot.
Yeah.
That's a lot. So I think, what are the things that we can do to reduce some of those concerns? Okay, I want to have sex when I'm on period. Can I have sex when I'm on my period? Like that's one thing that women, are actually, and I think women and men have, there's some stigma around that and some misconceptions and myths around that. You certainly can be sexually active when you're on your period, but you need to feel comfortable with that. So I think that those are some of the bigger ones. I think we also hear more recently, I know I grew up in the 80s and 90s, so like toxic shock syndrome was really, talked about a lot with tampon use. And so it highlighted the importance of making sure that you're changing your tampon, that you are making sure that you are not wearing it for a prolonged period of time. Now, I think one of the bigger things that's coming out is like, what are the chemicals that are in your tampons and your pads? And we're starting to recognize that there are things that we may be, environmental exposures that we have 25% of our reproductive life that we may not understand the consequences of that. And I think that that's still trying to figure out, like, of these toxins, what are harmful, what are the long-term effects. I think we don't know yet, so I don't want to cause a panic for anyone. But I think just being there's a lot of awareness that I also think is really positive. Like, what am I putting inside my body? What am I putting against my skin? What products am I using in my hair? What products am I using on my vulva? One of the other things, and I know I'm long-winded, but I think there's a lot, I think, in women's health right now, but right now there's a mass tort litigation against Johnson & Johnson with baby powder.
Oh, wow. Okay.
With some concerns for increased risk of talc exposure and ovarian cancer risk later in life. So, and I think that all of these things in the media, it does make people scared, right? And so it may, so I think that it's just nice to continue to have sounding boards of just being like, more likely than not, your tampon use for the last 10 years probably hasn't harmed you, but maybe if you're thinking about or rethinking about like what you want to use, how you want to approach menstrual health, it's a nice resetting point.
Now I want to talk a little bit about the stigma around menstruation, and I know that conversations around menstrual and vulvar health are often considered taboo. So why do you think this stigma persists, and how do you think we can normalize this?
I mean, we've been talking about taboo and menstrual health and vulvar health and sexual health for a really long time. And I think in the beginning, I think we thought that just talking about it would take that away. And I don't think that's the case. I mean, it's still, there's some underpinnings that show that it goes way deeper than just reading about it in a magazine or talking about it with your friends. So I think it really needs to start. And if we could, kind of start with early menstruation education for both girls and boys. who are, undergoing kind of that early elementary school education. I have a 12-year-old, so he's in the thick of it, right? He's like,
Yeah.
oh, I know about it, I hear about it. But I think that it's like the perfect time to really do about it, or to talk about it. So to hopefully normalize some of these things, make both girls and boys very comfortable with kind of some of these very, natural processes, and then also recognize when it's not, as I'm going to put in quotations, normal, like their peers. So, and when they might want to get help, encouraging and providing options for people to to choose what they might want to use, whether it's birth control or pads or tampons or menstrual cup, or I think that there's, it's a strange space in like adolescence to be able to start to be empowered to choose whenever you're not quite an adult, but your body's doing very adult things, and so, but if you actually look at like adolescent medicine, it's really on us to empower young patients to be able to make choices for their own body. So I think that that's the thing I would encourage and continue to do. And I would say doesn't mean that all hope's lost for like women who are outside of adolescence.
Yeah.
But it's just kind of maybe starting over, right? Like maybe taking a step back and being like, okay, I've been doing the same thing for
years,
30 years, 20 years, like maybe I should do something different. And I would say that, I know my answers are very long-winded, but like I would say that, like, as women, our cycle changes throughout our reproductive life.
Exactly.
You don't have the same period that you did when you were, thank goodness, when you were 13.
Yeah.
And it changes with pregnancy, with, multiple pregnancies, with, there are a lot of things that happen when we become perimenopausal, when we get closer to menopause. And so I think that with all of those changes, it's a chance to just reset and rethink how you're doing things. And maybe now is the time I'm going to try something new or different.
Okay, now I want to talk a little bit about the emotional and mental impact around menstruation. So in your experience, how do societal stigmas and misconceptions about menstruation affect individuals' mental and emotional well-being?
I mean, that's a really important question, because if you, usually these are captured in research as things that we call quality of life metrics. And underneath that is, can you perform your daily living activities? Do you feel like you're mentally healthy? Do you feel like you're physically healthy? And more recently, I think these have really come to kind of bubble to the top as like, these are the things that are really important for patients who are, especially reproductive age patients who may not be having a positive experience with their menstrual cycle. So I would say in the last 10 years, we've noticed and recognized that when you have a negative experience, so whether pain, bleeding, or both, so heavy bleeding or severe pain with your menstrual cycle, it's going to impact. In fact, it's almost impossible that it does not impact the mental, the physical, the emotional well-being, or those quality of life components that are reflective of how you move through your day. And I would say that in women who have severe impacts from either heavy bleeding or pain during menstruation, they really have a reduction in quality of life. And that can look differently with different people.
Yeah.
But I think it's something that we should highlight it's important. It is, this is not like a soft metric, like women are, we are the a huge part of the workforce. We are a huge part of the home workforce.
50% of the global population.
I
Just
know,
a
over
fun
50%,
fact.
over 50%. And we're responsible for taking care of our families. We're responsible for, many women being, primary breadwinners for their families. And so I think that that impact, when you have women who have this reduction in their mental, physical, emotional well-being, then it's hard to do all the other things.
Exactly.
And so I think it's really recognizing that menstrual health is part of your total health. Just like I think more recently we've recognized that like mental health is a part of our total physical health. And so I think that if you think you're doing really well, but you aren't doing well these 5 to 7 to 10 days of the month, like maybe you should rethink that.
Yeah, exactly. Yeah, and I feel like not a lot of women look at it as a whole. Like menstrual health is something external sometimes to ourselves, but it needs to be connected. So I love what you're saying about that. And I would like to now jump a little bit more into reusable menstrual products. So I would like to know, so we know that menstrual cups and discs have grown in popularity currently, but they're not universally, and also here in the US, not accepted completely. And what is your opinion on these products as an option for managing menstruation?
So first of all, I'm a huge fan of reusable menstrual products. And I say this because I've had many patients who've made the transition on their own and then shared their experiences with me, which has been how I learn a lot from my patients. But one of the things that have bubbled up to reasons why my patients have made that transition is many of my patients bleed a significant amount, whether it's for fibroids or endometriosis or adenomyosis, and they may find that their traditional protection, like if they're normally using a tampon, even with the very, super plus tampons, they may actually bleed around the tampon, especially during their heavy days. And so they actually find that they have fewer accidents. So I think that, they may, layer that with like a panty liner or something extra just in case. But it's interesting that the feedback I've received from many of my patients is even the ones who bleed really heavy have a positive experience. I think that some women haven't made the transition, especially in the US, is because it has not, I think, traditionally been a more of a part of the education that you get with the introduction to menses, right? It's like just now we're seeing young women being able to make a choice for like menstrual underwear. And those have been around for a really long time.
Wow.
And have been globally accepted for a long time. And so just more recently, I have, especially my younger patients, being able to get their period panties as part of like their introduction to menses. So I think it's part of that repeat exposure. It's making sure that women know what their choices are and understand the reason for their choices, separately. The other reason that we should be more proactive with our reusable products is just the significant amount of waste that occurs with disposable products. And so I think that we are much more aware than we've ever been about the global climate impact with that. And so I think that that's another reason, especially for your patients who are really just trying to make, we're all trying to make those small changes in our everyday to be better, just global citizens.
Yes,
right?
Exactly.
Being able to use this planet. So that's one way you could definitely make a big impact. And I don't know the numbers of what that impact is. I'm sure you do, but it's significant. Where I also see, I think where there's also been an uptake of reusable products are in countries where there's less available tampons and pads. Right? And so not only the thoughtful, conscious people making the decision, but also just access. And it's, I think that we can really learn a lesson from our other women who've incorporated these more climate healthy choices that also work really well for menstruation.
Yeah, that's true.
There's one of the things that I've heard from patients that they really liked is you also don't have to change it
as often
as you do, some of the things we mentioned earlier, but just the risk of prolonged tampon use. I think that there is a fear that they're going to put something that doesn't have, that's maybe doesn't seem to be as easy to retrieve as like a tampon, and that it's going to get lost. I promise you, the vagina ends. Like it is
it has a stopping point.
It has a stopping point. Does not go on forever. It is, if you put something in it, you can get something out of it, right? And so I think that part of that too is just educating patients and making them feel comfortable.
Yeah.
So I've had a patient bring, something here, and we've done it to put it in, and she wanted to make sure she could remove it, right?
Yeah.
And so she did it in the office just to make sure she could remove it, and she could.
And she was able to.
And she was able to.
Amazing.
Yeah.
All right. So now I want to talk a little bit about the hygiene challenges related with reusable menstrual products. So I know like cleaning reusable menstrual products in public or unfamiliar spaces can be daunting. And what do you think are the potential risks, and how can people address them effectively?
I think that this plays into one of the myths is that, because I do think like being in a public space it may not feel really clean or a sterile environment, but I do want to take a step back, and I think there's there is a misconception that the vagina is a sterile environment. And I would push back on that, right? It's a very clean environment, and it self-cleans, and I think most women understand that. But it is not something that I would, teach patients that would be, dirty or not able to put something in and out. I think that there's a fear of that. Like I'm going to risk putting an infection inside the vagina. No, I mean, right? You wash your hands before and after, but you would that's, I think, one of the myths of just anything that you would put inside the vagina, whether it's a tampon, a menstrual cup, a pessary, a vaginal condom. So there's a lot of fear, I think, with putting things in and taking them out. But I do think, and I think that this speaks really to, your company and novel idea, that there is like being in a space that's not your own environment. One, it's often not private.
Exactly. Yeah.
So then you are having to, it can be uncomfortable even going in, you don't have a tampon and just putting a quarter in and right, that can be uncomfortable. But then also then having to go and rinse out your menstrual cup, right?
Exactly.
Which can make you feel uncomfortable. It might make someone next to you feel uncomfortable because they might see blood or, so I think that having a more private way to do that is in a public space would be really helpful for women.
Perfect, thank you. And then my last question is around empowering individuals. And if you could share one message with the menstruating population, what would you say to inspire them to embrace open, informed discussions about their bodies and health?
Well, what I have to say is that women help women, right? And I think that's the thing I love most about my job is that, I think that it is, maybe you don't see it all the time, but I see it a lot as like women really do want to make the path easier for other people. So I think that if you're curious, ask a friend who might have had a positive experience or negative, like learn from that, right?
Exactly.
Ask the questions, find people you trust, bounce ideas off of, your local community, your online community that you trust. You have to be thoughtful about what you read. Your provider, right? Your doctor, you can ask these things. If you're worried and you want to try it, do it in a space where you feel like you can troubleshoot. like my patient did. Like, I'm going to bring this menstrual cup and I'm going to try it and make sure I can put it in and take it out.
And take it out, yeah.
Whether it's with your doctor or your sister or a friend. And I think that but women very much, I think, when we are, you know, kind of out of the spotlight and just on the ground day to day, we really do want to make things easier from other people. And the thing I hear from my patients all the time who have struggled for a variety of things are like, let me know how I can help other people. Let me know, is there a support group? Is there a, do you want me to talk to one of your patients? And I wish there were easier ways to do that because we have to protect people's information.
Yes, but, of course.
But I do think that, you know, if you ask, you might surprise yourself. Women helping women, right? Like,
yeah,
just
I love
from
it.
the very beginning. So
yeah, amazing. Well, those were all my questions.
Yeah.
So thank you, Dr. Erin, for taking some time today for this. This was very insightful, and I think a lot of women are going to benefit from this interview. So thank you, and I hope we can do more in the future.
Absolutely. Thank you so much.